The participant is a female retiree with a working background in nursing. She's aged 67 with a height of 170 centimeters and a mass of 87 kilograms. The participant's cardiovascular fitness was assessed using a physical activity training diary, a pedometer garment, and a 6-minute walk test. The pedometer found that the subject walked an average of 9,705 steps per day. Furthermore, the physical activity training diary established that of these steps, a planned brisk 30-minute walk was a large contributing factor to the total of steps. In addition, the 6-minute walk test further assessed the participant's cardiovascular fitness. The test concluded the participant was average upon the completion of the test. However, the participant did not meet their predicted distance. Completion of this test was successful in that the participant did not fall below average. However, the results also indicated that the participant had room for improvement. Further improvements in the participant's cardiovascular endurance will further reduce their risk of developing chronic illnesses such as cardiovascular disease. The assessment of the participant's body composition indicated that the participant fell into the obese category due to her body fat percentage exceeding 36%, this being the maximum range for her height and weight. Furthermore, the visceral fat readings exceeded the healthy ranges. This excess body fat and visceral fat is strongly correlated to a higher risk of chronic illness and poor health outcomes, such as excess pressure on the joints and the heart, increased likelihood of developing high blood pressure, coronary heart disease, type 2 diabetes, osteoarthritis, depression, and a range of other conditions. Furthermore, excess body fat percentages can exacerbate conditions which already exist, and also increase mortality over the range of 4 to 6 years. In addition to body composition measurements, the participant's balance was also assessed using both the tandem stand and the one-legged stand. The tandem stand assessed the participant's closed chain balance ability. The results showed a risk of falling when the participant stood left foot in front, while balancing with the right foot in front was within the normal range. The one-legged stand assessed the participant's open chain balance ability. Both trials on the right and left leg were unsuccessful, this placing the participant below average, hence at risk of falls. The measurement of the participant's grip strength was also taken, as this test has been proven as a useful tool in estimating overall muscular strength. The results collected indicated the participant was above average, indicating the participant has an adequate muscular function for their age, and hence reduced risk of falls and physical frailty. The most significant finding of concern upon the completion of the 2-week observation period was the participant's body and visceral fat percentages. The accumulation of body and visceral fat is a hallmark of the physiological aging process within older adults, which is detrimental to one's health and physiological function. The second most significant finding upon the completion of the tests and observations was the participant's balance ability. This was below average in most of the trials, with the open and closed chain balance assessments being conducted. This was of particular concern as accidental falls are the leading cause of injury and hospitalisation in Australia's ageing population. Falls can result in extended periods of sedentary behaviour due to injuries gained. This is important to note as current reports present a 7% increase in the yearly rates of head injuries resulting in falls for those over 65 years. Typically, balance declines due to age-related declines in muscular strength and tone. Hence, the implementation of mixed balance routines after the warm-up, and following this, the implementation of resistance training exercises would prove useful in building and maintaining muscular strength and tone. Furthermore, bone mineral density was also a measure of concern. Although the bone mineral density readings collected were ranked average, the participant was placed at risk of insufficient bone mineral density due to the participant being female and over the age of 65 years. Age and gender are proven risk factors that automatically place the participant at a greater risk of developing osteoporosis. These are risk factors as bone mineral density peaks in the late to mid-20s and declines at a rate of 0.5% per year, or more after 40 years. Furthermore, females have a disproportionate loss of bone mineral density after menopause, that is 2 to 3% per year. This age-related decline in bone strength progressively results in the development of osteoporosis, loss of independence, the development of chronic pain, increased likelihood of fractures and breaks. For these reasons, the following program largely focuses on ensuring the retention of bone mass and its respective structural integrity through the implementation of various weight-bearing exercises. Weight-bearing exercises have been strongly correlated to the preventing of age-related decline in bone mass. The program developed is a resistance training program which will aid in the reduction of the client's body fat percentage while increasing muscular strength and coordination, maintaining bone mineral density, and aiding in the maintenance and improvement of balance ability through the 10-minute balance segments implemented.